Good morning and welcome to the monthly OHI video conference series. This month we have two presentations for you. My name is Dr. Keith Klasinski. I'm the Statewide Education Director for the Oklahoma Healthy Aging Initiative, or OHI, as it is more commonly known. We are funded by the Donald W. Reynolds Foundation and operate within the Department of Geriatric Medicine at the University of Oklahoma Health Sciences Center. OHI is a statewide organization devoted to the health of older adults. We teach health classes for older adults and their caregivers, provide family and professional caregiver training, partner with health systems across the state to provide specialized geriatric care, and work with local leaders to promote the interests of older adults. A couple of ground rules for today's presentation. If you would, please take a moment and make sure that you are muted on your end. And after the first presentation and second presentation, we will have opportunities for question and answer, where you will be able to unmute and ask a question and communicate directly with the presenter. Our first presenter today is Dr. Jennings, and she is a geriatrician and assistant professor with the Reynolds Department of Geriatric Medicine at the University of Oklahoma College of Medicine. She provides primary care for older adults in the OU Senior Health Clinic. Dr. Jennings is board certified at geriatrics and internal medicine. She completed a geriatrics fellowship at the University of California, Los Angeles, her residency at the University of California, San Francisco, and earned her medical degree at Eastern Virginia Medical School. She also earned a master's degree in health services research at the UCLA Fielding School of Public Health. Her research focuses on improving care for older adults with memory problems, such as dementia. She is also the new clinical director for the Central Region of the Oklahoma Healthy Aging Initiative, located here in Oklahoma City, a program dedicated, as you know, to improving the health of Oklahoma seniors by increasing access to geriatric health care and providing excellence in health education and caregiver training. Dr. Jennings will speak with you about health literacy and what a geriatrician is. Please welcome Dr. Jennings.
Thank you. So good morning. I'm really excited to have the opportunity to talk with you today. I want to start out with talking about why health literacy is important to you and talk a little bit about what it is, and why it matters to you in your healthcare, and then also a little bit about how to talk to your doctor, some tips and tricks. Okay, so we're going to keep going. Next slide here. So what is health literacy? So October is Health Literacy Month, so this presentation is right on time. And health literacy is the ability to find health information, understand it, process it, and then use it, apply it in your own healthcare decisions. Health literacy is not the same as English literacy, and in fact, many people with strong English literacy still have trouble understanding health information, have lower health literacy, because often health information is just really too complex. I think all of us can relate to an experience thinking about going to the doctor visit and really walking out of that not really understanding what we're supposed to do, what the problem was, the words that were used. And that's because a lot of times physicians, myself guilty as this occasionally too, use jargon. We use words that we heard in medical school, but that the average person really wouldn't relate to. And so we're going to talk about how to talk to your doctor when that situation can occur. So health literacy also depends on the situation. So you may go to a doctor's visit, have the stomach flu, get some advice, get medicine, and come out of there feeling like you really understood the visit. But if you go in and you're not familiar with the disease that we're discussing, or the medical terms that are used, or how the disease is affecting your body, that's an example where, again, the information may be too complex. And so in a situation, even though your English literacy is fine, is good, that may be a situation where you don't understand exactly what's wrong. Also, sometimes medical information involves numbers, involves interpreting risks, making calculations, and that can be more complicated. And sometimes we receive bad news, right, at the doctor's office, and those are situations where you can feel overwhelmed, scared, confused, and that can make interpreting information harder also. And then, especially for older adults, as you age, sometimes you can acquire multiple medical problems, and sometimes those things interact. Their medicines interact, how they affect your body interacts, and that can make understanding the disease more complicated, and also understanding what you're supposed to do about the disease at home more complicated. So again, it's not one size fits all. in that sometimes it really depends on what information is being discussed with you, between you and your doctor. And I also want to reassure you that you're not, you're not at this alone. That difficulty understanding health information is really common. So there's actually been some national surveys assessing health literacy in the population, and they found that over a third of Americans, 77 million Americans, have difficulty with common health tasks, like following prescription drug instructions. So a lot of people actually have difficulty with health literacy, and you can imagine as the tasks get harder, the number of people who have more difficulty increase. So only about 12% of Americans report being able to do harder tasks, like calculating an employee's share of health insurance costs for a year. And I can attest that is difficult. It is difficult. So just to reassure you, you're not alone in this, if you're feeling a little bit overwhelmed occasionally. There are also lots of sources of health information, right? You may receive written materials either from your doctor's office or from a community organization, from OHI. There's also lots of different people that you encounter in the healthcare setting. It can be your doctor, it can be your primary care doctor, a subspecialty doctor, a pharmacist, a nurse, a social worker, a therapist, a physical therapist or psychologist, others. So those are all different sources of information. And sometimes one person is better at explaining it than another person. So I would encourage you to ask questions. It's okay. So if you don't understand your health care and what you're supposed to do about it, then we're not giving you the services that you need as the patient. So also radio and TV, right? We've all seen ads for drugs. We think, well, I have that problem. Is that drug right for me? One caveat I will say with TV is that, remember, those are ads, so they're selling something. And so it's completely appropriate for you to go in your doctor's office and ask. But just know that there is a slant there where you're the consumer and they're selling a product. And then the internet. And that's a big one, right? Like, as a physician, you definitely have patients that come in and they say, oh my gosh, I think I have this. Is this what I have? And what I will say is that sometimes the internet can be very useful. There are good websites, but there's actually many more bad websites where the information is not vetted, it's not based in medical evidence and research, where we have data to guide the decisions that we're giving people. And some of it's just plain wrong. And so what I would say is ask your doctor. A lot of us have websites that we feel like are good for patients. They communicate the information well, and then use those. It's unrealistic to say don't use the internet, because in truth, most of us would, if we can manage a problem safely at home, we would prefer to do that. And sometimes the internet can give you help with that. But if something's more complicated, you're not getting better, or you're not sure if the information is accurate, then I would seek counsel from your physician or nurse practitioner or PA. Let's keep going. Oh, there we go. Okay. And why? Why is it important? We talked about how community health information is hard to understand, where it comes from. Why is it important? Well, because poor communication between you and your provider ultimately leads to worse health. So low health literacy, as well as language and cultural differences in communication, can lead to problems in understanding each other. And the problem is we have a lot of data now showing that communication problems can lead to medication errors. If you don't understand how you're supposed to take it, or how a medication's been changed, or which medication to start or stop after a visit. Following recommendations for things you can do at home, like diet or exercise. Monitoring symptoms, like you're monitoring your weight, or your blood pressure, or your blood sugar, when to do it, what to do if the reading is too low or too high. Poor understanding of your treatment options for your disease and your expected course. So what does this disease look like over the next 6 months, year, 5 years? What are the options I have for care? And how do I interpret which option is best for me? If you and your doctor aren't communicating well, you may miss your appointments, or miss tests, miss opportunities to get preventive care that may prevent you from getting diseases as you age. And ultimately, when you're at home and confused, then that leads to a phone call and another office visit to try to explain things. Or even in the worst case scenario, which is the picture I have here, a hospitalization, where maybe potentially something could have been changed or a problem prevented. And ultimately that leaves you feeling unhappy and less satisfied with your care, which is, I think physician standpoint, just the exact opposite of what we would want. We want you to walk out of there empowered with the information that you need to be as healthy as you can be. So what can you do when you're with your doctor to help things go more smoothly? And I know we have another presentation that's going to go into this in a lot more depth, but these are just a few thoughts. So if you're not understanding your doctor, if they're using language that or words that are more from a medical textbook than from everyday use, then stop them and say, I don't understand that. Could you stop and you really tell me in plain language. And then please let your doctor know if you do have trouble with reading, or if the materials that you're given are too complex and don't make sense to you. We often in medical education, when we're teaching our new doctors, use something called teach back. And this is a method that you can actually train your doctor to use with you. So this is, tell me back what I just told you. So what I try to do this with my patients, but you can also do it with your doctor and say, hold on, let me tell you what you just told me so I make sure we're on the same page. And that's a really effective way, because sometimes you think you've understood, but it's really different. Or the doctor thinks they said something, but you've understood something else. So that's a good one. So use teach back. Ask your doctor if they have a picture that could explain the problem. A picture either of the disease process in the body, or sometimes a picture's sort of worth 1,000 words, and sometimes that's an easier way to explain a complicated problem. Take notes in the visit. Sometimes there's a lot of information coming at you, and so taking a few notes can help you organize your thoughts. It can help you realize where your questions are, and it can help you remember the most important recommendations when you go home. And then in that same vein, ask for written instructions, especially regarding your medications, any changes in your medications, and your appointments. And then the last piece is that, this is particularly advice for older adults. As you get older and you acquire more problems, you also acquire medications for those problems. And sometimes there's a lot of them. And so sometimes one of the things that as a geriatrician we work on a lot with patients is how to simplify those. So I would never give you advice to stop medications without consulting your doctors. I don't want you to go home and change your medications on your own. But it's very reasonable to bring in your pill bottles to your doctor's office and your medication list and say, this is complicated for me. I'm spending more time doing this than the things I want to do, which is often the case. Can we simplify it? Can we change the timing of the dosing, the frequency of the dosing? Could we cut back some of these medications and see if I really need them? Those are reasonable questions, and sometimes those small changes can lead to big impacts. Because I think the goal really is, at the end of the visit, any doctor, any encounter that you have with a healthcare professional, to walk away understanding these three things. What is my main problem? What do I need to do about it when I leave this office? And why? Why is it important for me to do these things? And if you understand these three things, you're much more likely to be able to follow through with the advice, and you'll want to follow through with the advice because it'll make sense to you why you're doing it. And ultimately, our hope is that that leads then to better health outcomes. So I have a little comment here, which I can't read the print, so you probably can't either, but it says health literacy when doctors and patients actually truly understand one another. And what you see here is the doctor saying something and his bubble being that same picture. I think that's our goal there. My next topic is going to be about what is a geriatrician, and sort of what a geriatrician offers. But I could also pause here and take questions if people had specific questions about health literacy. Yes.
Yeah, so what do you recommend to somebody who is, English second language or doesn't speak English, and then brings their child in with them as a translator? What is optimal in that situation?
So I would bring your child with you if you speak English as a second language, but I would encourage you to ask your doctor for a formal interpreter, because sometimes your child may be a wonderful interpreter, but they may also not be, and you won't have any way of knowing that. And your child, though, may have ease with both your primary language and English, they may not have ease with the medical terms in either English or the other language. And so sometimes a trained medical interpreter is really valuable in those situations because they make sure that what I'm saying in English is getting translated into your primary language in a clear way. And again, it's all about making sure that you understand what the problem is and what you're supposed to do about it and why. And I think often a medical interpreter is the most, the clearest way to really make sure that happens, because you don't want the perpetuation of misinformation. And that's really the standard of care. So that's really the expectation, is that we be able to provide information in the language that is most comfortable for the patient. So I will do greetings and include the child in that conversation, just like I would for any child, but I would use an interpreter in that situation, and that's what I would encourage you to ask your doctor to do also. Yes?
What is the best way to prepare for your doctor's visit to get the most out of it?
That's a great question. So I think just like any meeting, you sort of want to think about why you're going in and what you're hoping to get out of that visit. So I would have that sort of in your head. What are the things you want to make sure that you talk with your doctor about? And I would write those down. I have never seen a doctor who said, oh, they have a list. They're like, oh, they have a list. Because it's really helpful, because it helps the doctor know what you want to talk about, and then you guys can prioritize. You may not be able to cover everything on the list. The doctor may have one or two things that they really want to make sure that they also squeeze into that visit, but it helps you negotiate that agenda. What are the things that are most important to you? And then hearing your doctor's side. Okay, well, he says that my coronary artery disease is really important, so we'll cover that too. But that allows you to have a sort of shared decision making around what's important. So I would say, think about what you want to get out of the visit, take some notes, come to that with the visit, and the third thing would be your medications. So either bringing your pill bottles to your visit every time, or bringing a list that's accurate of what you're actually doing. Because sometimes what we think we have written down as you taking and what you're actually doing at home are different. We want to make those match as best we can. So those are kind of the two pieces of advice. Make a list of what you want to talk about, and make sure you bring in a medication list or your pill bottles. Okay, if there's no other questions, I will go on to the next one. So what is a geriatrician? So I'm a geriatrician, and I'll talk in depth about it, what it is. I'm not a nutritionist, I get that one a lot. And I get gerontologist a lot. But we'll talk about what a geriatrician is. So a geriatrician is essentially a doctor who cares for older adults. The analogy I use is a pediatrician. So you have a pediatrician who specializes in the care of children, and a geriatrician is on the other end of the age spectrum, a doctor who specializes in the care of older adults. It's usually an internist, so someone who's had as a physician, someone who's gone to medical school and then had a residency either in internal medicine or in family practice. And who then has gone on and had extra training in geriatrics, so an extra year of clinical fellowship in geriatric medicine. So that's what it is, but essentially, basically, doctor for older adults. And a geriatrician can be a primary care doctor. So I have a primary care practice where I take care of patients that come and see me for their regular routine health care. Or I'm also can serve as a consultant to other doctors. So a family physician or an internist seeing patients in the community who has an older adult that's developing problems that are coming with age, and sometimes coming to see me for a visit or two is helpful. Geriatricians also can work in hospitals as hospitalists, though not as commonly. And often geriatricians will work in nursing home settings too, taking care of people who need to go to a nursing home for a short period of time after a hospital stay, or people who need to actually live in a nursing home because they need to be in that more of a supportive environment for whatever reason. So what does a geriatrician do that's different than, say, an internist or a family physician? And geriatricians really specialize in problems that are more common as you age. So I've listed a few here. So those are like things like falls, problems with walking or balance that can develop as you get older. Memory loss, or dementia. So about a third of older adults, adults over the age of 85 have significant memory problems. So this is something that memory loss is not normal as you age. It's not a normal part of aging, but it is much more common as you get older. Problems with urination and bowels, so this might be leaking urine when you laugh, cough, or sneeze, or it might be chronic constipation. These things happen, and geriatricians can also often give advice around how to manage that. And then again, we've talked a lot about multiple medications, and that certainly is something that can happen, and sometimes sorting that out can be an area where a geriatrician can help. So I often get asked, so if I'm 65 and now I've got Medicare, should I go and see a geriatrician? And I would say age is just a number, is my response to that. So what I would say is in general, geriatricians see adults that are over the age of 70 or 75, but it really deals with sort of how you're aging. What are the problems that you're developing as you age, and are those problems that a geriatrician can help with? So again, if you're an older adult and you have several health problems, if you have difficulty managing your medications, if you've fallen or you worry that you may fall, or you have problems with walking or balance, if you have difficulty moving around your home in the way that you'd like to, or it's becoming difficult to get out of your home, or if you have concerns about your memory. These are all areas where geriatricians really specialize. The other counter to that is if you are caring for an older adult, whether that be your spouse maybe, who's either older than you maybe or not aging as well, and you're feeling stressed out or overwhelmed or worried, a geriatrician can be really helpful, both for the person you're caring for and also for you as a caregiver. And that goes too for children that are caring for aging parents. The last thing I'll say that is geriatrics as a field, geriatric medicine and gerontology is really a team sport. So one of the things that we as geriatricians really try to do is draw on the expertise of others. Many geriatric models of care have what we call an interdisciplinary team. So where we will meet with the patient, but we'll also confer with other health professionals, physical therapists, pharmacists, psychologists, social workers, nurses, because each of these people have expertise in different aspects of care, and they can provide advice that will help the patient. And so we like to work in teams in geriatrics. And with that, that's kind of my summary of what geriatrics is, geriatric medicine is, what I do as a geriatrician, and I'd be happy to take questions. And I'll read the comic. It says, "B. Wood, MD, Geriatrics. How appropriate. Antique magazines." The patient's reading in the waiting room.
Thank you, Dr. Jennings.
Yeah, thank you.
We appreciate you coming and talking to us about those topics. Next, we will have Sara Sherry, and after graduating from the University of Oklahoma in 2005, Sara Sherry, just need to switch this real quick. Sara Sherry has spent most of her career working with older adults and caregivers. Since 2013, Sara has been an education specialist for the Ojai Central Center for Healthy Aging, where she teaches life-enriching health and wellness programs with her unique skill to connect with participants. She credits her own life experiences for driving her passion to empower older adults to have or regain the quality of life reflective of their efforts. Please welcome Sara Sherry.
It's a tongue twister.
Yeah. You would think I put my last name.
So I always leave that last part off. Well, hi guys, welcome to Talking with Your Doctor. I see some of my friends out there already, so hello, I hope you guys are doing well this morning. So this is a great presentation to follow up with what Dr. Jennings spoke to us about, and this is a little bit more detail about how to take a more active role in your health care, how to become a better partner with the healthcare team. I'd like to note once again, obviously you noticed from my intro, I'm not an MD, I'm not a medical professional, I'm a community educator. So I'm here to just provide you guys with some extra tips and tools to make things easier for you when it comes to that once a year or twice a year appointment with your doctor. The information in this presentation comes from the National Institute of Health, from the National Institute on Aging, and it's a great presentation with lots of information that's useful. So in the past, I know that we all generally had a different relationship with our doctor. You had that one doctor that you grew up with that knew you since you were itty bitty. They knew all your health concerns. They knew your entire family. It was very easy for them to keep track of your medical records, your medical history, because they knew everybody in the family. And as medicine has changed and progressed, and we have specialists now and access to different types of care, that has changed. And so in that role, we've had to change how we approach these doctor's appointments. We can no longer really rely on that one person to kind of lead the charge and tell us what to do. We have to take more of an active role with that doctor. And so in this role, we're gonna be expected to do some things. There's gonna be a little bit more work that we need to do, but it's great because this puts us back in that driver's seat when it comes to our own health. So the first thing we're going to be expected to do in this new role is we're going to be expected to ask questions. We need to ask questions of our doctor. If there's something that we don't understand, like Dr. Jennings was saying, we really need to take the time while we're in the visit to ask those questions and get clarification. Definitely don't want to leave the appointment not knowing what's going on. If the doctor's using too technical a terms for you, you definitely want to make sure that you get clarification on all of that before you leave. You don't ever want to leave an appointment being confused. That's the time to get the advice from the expert. Next thing you're going to be asked to do is to speak up. And I love this part of the presentation because we all know we've done this. You know, the mute patient. You go into the doctor's office, you have a list of ideas or things in your head that you need to discuss with the doctor, things that maybe have been bothering you, and the doctor comes in, hey, how are you doing? And you're like, fine. Anything changed since the last visit? Nope. Right? And I see you laughing because we all do it, you know, and you either think to yourself, I'll get to it next time, or we wait till the doctor has their hand on the door and they're ready to leave that appointment. And then we're like, oh wait, I have a list of things I need to talk to you about. So we really need to make sure that we talk to the doctor about things that are bothering us, such as pain in the hip, symptoms like fatigue, symptoms that aren't going away. We need to make sure that we let the doctor know if we're unsure about a recommended surgery or a treatment plan. And by having this communication, by asking questions and speaking up, that puts the role of the communication both on you and the doctor. So it becomes more of a partnership. So I know that this is easier said than done. And so we're going to talk about ways to make this process easier when we're getting ready for the doctor. And we're going to do this by talking about how to get ready for your appointment, how to share information, and how to make decisions with your doctor, which is really, really key, that word with. It's more of us taking a role in that decision-making process when it comes to treatment plans and treatment options. Oops. So I'd like for us to just think in our minds for a second. If I said, hey, can you quickly tell me everything that you ate yesterday, everything you drank yesterday, including the approximate portion size, what time you ate, you know, any gum that you had, breath mints, what time did you brush your teeth in between, and you're having to think of all that information and get it out in a short period of time, I think we can all say that's kind of similar to getting into the doctor's office and trying to communicate with them everything that needs to be communicated in that visit. It's hard to recall, you know, in that moment, every health issue you've had since that last visit. Any concerns that you want to discuss? What medications you take and their dosages? What new medications have you been prescribed? And what over-the-counter drugs, vitamins, and supplements are you using? You might feel under pressure to get everything into that visit, and you might also overlook something really important. So when we're approaching our doctor's appointments, we need to get ready for them. Like you get ready for anything that you only did every 6 months or once a year, you want to make sure you're ready for that appointment. And the first thing you want to do before you go to the doctor is create a plan. You know, think about what you want to accomplish in that doctor's visit. What do you need to get out of that doctor's visit? And you do that by listing and prioritizing your concerns. So you want to list symptoms. How long do they last? What makes them better? How are they affecting your daily activities? How are these symptoms impacting your life? And if possible, start this list early. I have participants in my classes that keep a spiral notebook of their symptoms in between visits, and then they can take out that notebook and from that list, prioritize the things they need to discuss with their doctor. Instead of trying to recall everything at the last minute. You also want to note any other health and life changes since your last visit. Have you been diagnosed with new illnesses? Have you had an operation? Other medical conditions? Have you visited the emergency room or visited a specialist? Have you had changes in your appetite, your weight, your sleep, your energy levels? These can be huge keys in diagnosing medical problems. Have you had a recent loss or a move? And it's funny because that kind of sounds like a strange thing to throw in there, but as we talk about, in a lot of our classes, how emotional things can impact our physical and our mental health. If you've had a major loss or a move, something very stressful, that can have a huge impact on your health. I always use the example, I was a senior in college when my father passed away very suddenly, and they could have diagnosed me with all kinds of stomach issues, sleep disorders, gosh knows what, if I hadn't been able to communicate to them that I'd had this huge life change, I'd had this huge loss in my life. So it's important that we communicate those things to them so that they can understand the whole picture. Also, have you had changes in medications? Are you having specific reactions to medications? These are all really important things for us to note when we're getting ready for that doctor's appointment. So, getting ready for the appointment, you want to gather information that you're going to take with you to that doctor's visit. So you want other doctors' contact information. If you're seeing specialists, anybody else that's on that healthcare plan, healthcare team, you want their names and their contact information. Also, insurance cards. We got to pay for the visit, so make sure you have your up-to-date current insurance cards information with you. Your medical history. Okay, so if you are visiting a new doctor, it's completely appropriate to take your old health records from your prior physician, test results, any of that stuff from your prior doctor to the new doctor. You can even arrange for those medical records to be sent to your new doctor. You can give permission while you're there for them to contact your old physician and get those records. Also, if you're seeing a new doctor and you're going to have to fill out that paperwork that they give you anytime you visit a new physician, call and ask if you can have that mailed to you ahead of time so you can get that all done with all your information before you go to that visit. Also, bring a complete list of your medications, and this is prescriptions, over-the-counter pills, vitamins, supplements, eye drops. They need a clear list of everything you're taking. If you don't want to write everything down, throw those in a bag and take them with you. Just make sure you don't misplace that while you're there. It's possible, and we know this for medications, to interact with one another. Different doctors prescribe different medications. So our doctors need to know every single thing that we're taking. And that includes interactions with supplements, over-the-counter allergy medications. So they need to know everything you're taking, when you're taking it, and so forth. All right, so getting ready for the appointment. You want to think about what you're going to need to see, hear, communicate during this visit. So if you wear glasses or hearing aids, make sure you have those things with you. Consider bringing a family member or a friend. Some doctor's appointments that we go to are emotional, or there's a possibility we might be receiving some information, or we're going to hear about a lot of things that we need to, take good notes on. So maybe you bring a friend or a trusted friend or a family member with you that can help you take notes, write down things that you're going to need to remember moving forward. Just make sure that this person is not going to take too much of an active role, that they're really there as a support figure, and they're going to let you have that appointment with the doctor. You also want to make sure this is a person you're comfortable asking to step out if you need to discuss anything privately with your doctor. And, like Dr. Jennings said before, ask your doctor for an interpreter if you need one. And they can, work on getting a professional interpreter there so that you make sure that you're getting all the clear information that you need. All right, so now it's time to set that plan into action. So we prepared for the appointment by making a list and prioritizing our concerns. We've written down all our medications, or we have our medications with us. We've noted all the changes in our health and our life since our last visit. We're going to wear our glasses, we're going to wear our hearing aids, make sure we're ready for that appointment, and you may even practice the things that you want to say to that doctor, making sure that you feel comfortable getting that information across to them. So we're ready now to set this plan into action. So in the image, this is really interesting. I love this activity because taking a look at the image on the screen, there's a doctor meeting with a patient. And if we ask the question, what do you think is going on in this photo, we're all going to have a different interpretation. Is this person meeting with their primary care physician? Are they a caregiver? Are they seeking information for a loved one? Is this a follow-up appointment? What could this person be feeling? What might be their symptoms? We're all going to have a different interpretation of that. And this is a great example of how, when we're communicating with our doctor, how our doctor and us can have a different definition of symptoms that we bring to the table. People have different meanings for words like pain and fatigue. If you tell your doctor you're experiencing pain, they might have a different definition of that. If you're telling the doctor you're experiencing fatigue, then they might have a different definition of that. So this is our job, to communicate completely with the doctor and paint the clearest picture we can possibly paint of our symptoms. We're the ones that live in the body 24/7. So we need to be very clear with them so that they can best treat us. So you want to make sure that you describe your symptoms in a clear and concise manner. Examples might be fever, pain, you're experiencing a lump, unexplained weight loss, fatigue. So you start with the symptom. What is it? What exactly is the symptom? When did that symptom start? How often do you have the symptoms? Are they all the time or sometimes? What makes them better? What makes them worse? Are you taking anything over the counter that's helping with those symptoms?